that in the world context, and also what he sees as potential paths forward. And on the other hand, we also have Dr. Chen Liang-Gee, who will describe to us what some of the tools being developed right here in Taiwan through one of the most powerful, technologically advanced organizations in the world, what those capabilities are. And before I go further too, a quick introduction of Professor and Dr. Chen Liang-Gee is that he is the not only the head of MOST, Ministry of Science and Technology, but previously a professor at NTU. He is also the creator of the Startup Garage program, the Taiwan Tech Arena, which is also an entrepreneurial organization, and the LIFT program, which helped bring myself, personally here. So I would not be here without some of the unique programs that the ministry has actually created. So thank you for that, Dr. Chen. And then, however, we will start today the discussion again with Professor Jason Wang. And he is also a person that doesn't require too much introduction because he's been on the news a lot. His recent JAMA article, the Journal of American Medicine, has garnered almost 1 million views and has been covered by more than 200 media organizations, including Al Jazeera. I hear you were talking to them yesterday, and then immediately after this, there'll be other media organizations as well. And the reason for this is that he was one of the first to highlight Taiwan's extraordinary response. He also, in his past history, has helped reshape and reform the Taiwan healthcare system. So he is no stranger to Taiwan, no stranger to epidemics, and no stranger to the world situation, being as he lives in San Francisco in the middle of a lockdown. So without further ado, let me first pass it to Professor Wang to describe the situation as is.
Thank you so much, Ping. I hope this will be a dialogue.
Yeah.
And I'll get started with what I know, and then maybe we'll ask the minister to comment, and we'll have a dialogue. And the minister is one of the most admired persons for me. I'm a big fan of the minister. No one really has basically integrated education and technology development the way that you had contributed to Taiwan and also to a lot of young people. I think it's wonderful, and it's a privilege to be in the same forum with you. And thank you, Ping, for organizing this event. So I'm going to show some slides, and mostly it's just to set the stage for understanding the viral infection, and then we'll go from there. So
it'll take a couple seconds to load, but
okay. So can you see the slide?
Yeah.
Okay. So let me just describe the situation a little bit on where we are, both in Taiwan and in the United States. So early in the infection, really, we are talking about containing the virus. And so I think this is where Taiwan has done incredibly well, is the delayed introduction and spread of the disease to the community. So Taiwan does this by border control, getting on the flights of people coming from Wuhan and other hotspots, and then really take proactive action in detecting disease early by travel history and national health insurance data, combining with immigration and customs data to know people's history, and then contact tracing. There's incredible effort by the Ministry of Health and Welfare and the National Health Command Center. The team there is done an incredible job where they're training everybody to be an epidemiologist. And so if I take a regular Taiwanese citizen, that person probably knows more epidemiology than our undergrad here at Stanford. So Taiwan, because it has done an incredible job with containment, it never really moved to sort of major mitigation strategies in terms of lockdowns, like what we're currently experiencing here in the United States and certainly here in Silicon Valley. And so, in California, when we first discovered a few cases, it was evident that there's already been community spread, that the disease has been here for a while. It's just that nobody knew where it came from. And certainly the individuals who initially in small communities had never traveled to China and doesn't remember having been in contact with somebody from China. So that means it could be somewhere in the community. So because of this, there was a requirement to start mitigation strategy, which is based on social distancing and based on shelter in place, basically staying home. And in order to minimize the spread of the virus to other people, because you don't know where it's coming from. Now, this is very different from if you know, the traveler got it from this place, and then the family member got it from the traveler, and then the girlfriend got it from the family member. So then you have, a good trace of what's happening. But in mitigation strategy, you just try to separate people to avoid contact and to avoid the spread of the virus. Okay, so there is a curve that people commonly use called flattening the curve, and I think this will be important as you think about designing new products and services. And so if you don't flatten the curve, basically you could have a surge, and with a surge you could basically overwhelm the hospital system. Too many patients, not enough hospitals, not enough ventilators, and the doctors and nurses start to get infected, and then the hospital will close down. And I think Taiwan has experienced some of that during SARS in 2003, where hospitals were either partially and in one case fully shut down. And so in the US, we start with social distancing strategy, the green curve here. And then if you do it really well, you become the blue curve. But then in the US, we're starting to think about, okay, well, if you tell people to stay home and not go to work, it's very harmful to the economy, right? So, and then government has to keep on printing checks for people to survive. And this is not a long-term strategy. So then in the US, we're thinking, well, how do you gradually lift shelter in place? But people are also afraid that if you lift it too quickly, that it will get a secondary surge. So then how do you lift it a certain way? What are the strategies of lifting it, and what tools do you need when you have that intervention? So that's another context. The third context is you really have to understand the biology of the virus in order to create therapeutics and vaccines. And I know some of you are interested in that. So as you know, this is an RNA virus with a positive strain RNA. It's a genetic material. It has a spike protein that binds to probably the ACE receptor. And then it starts to replicate both to produce proteins and also a genome for the virus. And if you look at the viral pathway of replication, then you start to realize that there are ways to develop vaccines, and some of them are using viral vectors. The top one, where you insert some genetic material and try to produce the part of the viral protein as the antigen, and then some of them you could use the DNA vaccine, and then this one you use the RNA vaccine, so you could package the RNA in the most stable way to generate immune response. And then also live attenuated vaccines is also possible, basically a weaker form of the virus. And then you could have protein-based vaccines as well. So those are sort of the ways that people develop vaccines. But then in terms of the therapeutics, currently the most talked about is remdesivir by Gilead Sciences. And what this is actually it incorporates into the RNA building block, so kind of screws it up as the virus try to replicate, and so it sometimes it just disrupt the viral replication and being able to add more RNA units and thus holds the replication. So when you think about sort of therapeutics, you have to think about where the therapeutic target is. That are you trying to prevent binding of the virus? Are you trying to disrupt the replication of the virus? Are you trying to prevent virus from going out of the cell, the new viruses? So there are all these targets. And so again, I mean, this is somewhat where the opportunities are. And then as you're trying to track an epidemic like this, you also talk about, what are the symptoms? And I heard a lot of people trying to create an app to track symptoms. And there's already been like 20 of those. So unless you have a much better method, it's going to be very difficult, because so far you have to understand more about the biology of the virus in order to understand more about the symptoms, and these things are changing as well. So I want to end with this slide, and so that we could have a discussion. So one is that it's important sometimes to figure out what do we know, like right now, what do we know, and what's knowable that we currently don't know. So, for example, in the science part, how much viral load matters for infectivity. Do we know that? Like if somebody has still a little bit of virus, is that infective? How much exposure is required? Do we know that? Okay, and then if not, how do we find out? In the practice of medicine, how many different types of tests are out there? So that everybody's creating their own test. But do we know about their properties, like the sensitivity, the specificity, the cost of that test, and the time to do the test? So you need to compare all those things in the practice. And then in the delivery, how do we do contact tracing and follow-up care at a massive scale? So they say you find a way to do contact tracing, but then how do you follow all these people up as the numbers start to become very large, like in the US? How do you do that, right? Or how do you produce enough tests? And this is all delivery question. Who's going to pay for it? That's another thing, right? People don't think about this, but in reality is that who's going to pay for patients with COVID-19? And in Taiwan, it's easy because you have national health insurance, but in the US, a lot of the insurance companies are based on employment. So if you no longer have a job, who's going to pay for it? So that's another question. And so when you design a product, you need to figure that out. So then what do we do? In terms of the science, you need to design proper experiments or identify useful data sets to test your hypothesis, right? So, if you don't know something, how do you design the experiment to do it? And then, you need to figure out how do we get there? Like how long would it take to answer a question? And where the resources going to come from. Now, if you are interested in a particular set of questions, that's important to contain the disease. Now, in practice, you need to design and compare different tests and with their positive and negative findings. So people are very interested in things like, oh, I tested positive or I tested negative. But that's meaningless without knowing the properties of the test, right? Without knowing how sensitive it is, because you could get false negatives, right? So you think you're okay, but really you already have the disease that you just didn't know, right? And then in the delivery of care, you need to develop, and this is an important point that I want you to remember, you need to develop an integrated technology package to do contact tracing and follow-up care. So nobody is going to take your little piece of technology and this other piece of technology and try to integrate it, but people are too busy and there's not enough time. So can you create something that's integrated so that people could just do plug and play, right? And then the other thing is that what does the supply chain look like for each of the key materials for testing, right? So if you develop something, can you scale? I mean, most people just think about getting the FDA approval, but how do you scale? How do you bring it to your clients, and how, and in what way, and how does that integrate with the delivery system? And how do we integrate technology developed by different companies into a secure platform? And so with that, I wanted to sort of open up for discussion. Right. Let me just make sure that I could share this.
Right. And Jason, what I noticed you focus on is a lot of the sciences, which is what you focus on, which is fantastic. And there are many scientists in the room here virtually as well. And we are, after all, at the Ministry of Science and Technology, which funds most of the R&D in here. But of course, there's also the other elements, including the social components, the repercussions of social distancing, for example. So people could also be creating apps for doing better yoga at home, or etc. Right? So just wanted to
absolutely.
That's fantastic. Now, before we go on to Minister Chen, let me see if I could summarize the overall picture of where we are in the map, and feel free to agree or disagree. But it seems to me that stage one, which Jason, you've done a very good job of highlighting, is the fast government response. And it was all about government and how they conducted it, right? And Taiwan did an extraordinary job, and today we are open for business. That led to phase two, which is what we are in today, which is all about production, producing masks, producing PPE, etc., just meeting the world's needs and demands for our livelihood, for our ability to survive. And because Taiwan is one of the few countries in the world that is open for business, we are also excelling at that. But now, it seems to me that we're going into a phase three, which is all about innovation and engaging the citizenry. What each of us does, conducts ourselves, but also the ideas and solutions that we come up with. And so I think this is an interesting place to kind of go over some of the things that MOST is doing before we hand it off to Minister Chen. One of the things that he's supporting is not only his vast network of laboratory research, but commercialization and entrepreneurship. He created Taiwan Tech Arena with its many accelerators and various programs, as I mentioned, the LIFT program, bringing scientific expertise here. And he's supporting Techstars, which is creating a new global challenge. So you can, at home, basically come up with solutions and work with other people. And that is found at covid.startupweekend.org. So I just wanted to throw it out there. And many of the people and listeners here are looking for potential paths forward to create for this challenge. And this challenge will also come with prizes and also the ability to turn your idea into reality. So thank you, Minister, for supporting this Global Grand Challenge. And thank you for everything you've done for Taiwan to keep us on track. But we would love to learn your thoughts on Jason's views here in terms of how we got here, but also, most importantly, the path forward and what the ministry and what Taiwan can do in general for the world.
Okay, thank you, Pin, and good to see Jason and all the friends online. Especially Jason is a very outstanding medical scientist and also a very good entrepreneur. So you mentioned about the very good combination of all the actions from Taiwan experience, and also pointing out a very important issue for not only just provide the solution, but need to consider about scale up, especially to face the worldwide disaster. I'm not a medical scientist. I need to mention first. However, some of the duty as the Minister of modern Science and Technology, I think I can share. First of all, I can share some of the experience, especially based on the talk that Jason just mentioned. Taiwan has a very special condition, especially face the so-called virus disease attack, because Jason just mentioned 2003 we got a very serious attack come from SARS virus, and at that time we not only shut down some of the hospital, but very sad, so we lost some of the very young doctors during that attack. So I think from my personal view, especially as the Minister of Science and Technology, I think there are three main points I need to mention, because talking about the innovation, we always say you need to understand clearly about the problem, and some of the problem may learn from the history. So I think the experience of Taiwan to prevent this so-called COVID-19, we have I personally have 3 points. The first one is be well prepared, especially for the responsibility of science and technology. After SARS virus, we continue to support a lot of medical and scientific laboratory. We continued from 2003 to here, so more than 300 different laboratory, including medical laboratory, including the small molecular synthesis laboratory, and also some of the detection and testing laboratory. So we keep the momentum for the research resources. And the other one is that we well prepared to changing the regulation. So you can see we opened the so-called epidemic central epidemic command center very quickly, and we prepare all the regulations so we can use the regulation to set up the environment, and it's very commended to all the people. The second point I need to mention is using the experience, we are very proactive. That means we very sensitive to where is the enemy come from. As Jason mentioned, the virus we cannot, people are unknown to this virus. However, we can see some of the sign. It's more like an entrepreneur that you need to identify what's the need. So we see the needs come from like Wuhan at the first case. Even in the academia side, actually, we have some medical doctor understand the situation just in around the end of the last December. So some of the hospital already have a discussion, and even in most, we have some academic discussion during that time. And so in the end, beginning of the January, we preacted very quickly. We set the so-called the border control that Jason mentioned. Not only the border control, but we can very quickly to leverage all the laboratory. As I mentioned, we have 300 laboratory together. So Taiwan become even we have very small cases, but we become the fourth country can identify the virus strain. And currently, we have a lot of different kind of virus strain can help all the researchers. So we keep an eye open for all kind of these unknown enemy. The third point I need to mention in Taiwan, we use the technology very quickly. Taiwan is very good for industry supply dimension. So we have all kind of related industries together. So the government is very good experience to use the technology, not only in medical treatment, but also we are famous in this case. We understand many countries understand Taiwan use the so-called digital fence. So we can try to reduce the most inconvenience for the people. For example, some people need to do the isolation, but we use digital fence to help. So it's not getting so inconvenienced. I think that's very important that people can fully cooperate with the government. So now it's really, I think we can have the good chance to prevent the spread of the virus. So far, Taiwan, even at the beginning, the Johns Hopkins University mentioned Taiwan could be the second highest cases in the world. But right now, I think Taiwan still keep as the population with 23 million population. Till now, we still keep only around 400 cases. I think this shows all the activity is pretty good. So as I mentioned, most try very hard to support all kind of innovation, even to face this unknown enemy. And we try to leverage all the science and technology together. And I should also mention one experience that Taiwan is also a very complex disaster area. The complex is another, we got the challenge come from virus. We also got a very good, very challenge come from like earthquake, like the flu typhoon every year. So we face this of challenge, you can say every year. That's why we have the regulation and all the system is so resilient to face these times to face the COVID-19. So this experience is very good to say that Taiwan inherently we have the environment to push the people. We need to have the innovation, then using the innovation to face the problem, to provide the solution. And of course, in Malta, we also established the TTA. The mission of TTA is try to incubate the innovator and also to using the environment to help that we can scale up our solution. That's a single link to the Jason's suggestion. Scale up the solution is quite important. So you may understand Taiwan. We say we have the so-called Taiwan team. One of the very good example is the face mask Taiwan team. And right now we are trying to have the Taiwan team for the quarantine, for the testing, and finally we hope we can also have the Taiwan team for vaccine research.
Thank you very much, Minister Chen. So that is an interesting note to say. Minister Chen mentioned, for example, that there are already solutions out there that MOSC is working on, for example, geofencing and contact tracing. That's actually been one of the highlight technologies that's been emphasized over and over again. Jason, directly to you, is there any more room for improvement there? I mean, we've got a room full of entrepreneurs here. Is that something that we should be looking at and can be improved at all, or what's needed?
Yeah, there's a lot of room in that space. Yeah. particularly if you have a good product. So, in Taiwan, you have a lot of excellent public health workers and Taiwan is small, so and then you have the war system where you have Li-Zang, right? And you have household registration. So it's easy to track people. You could send somebody to visit somebody very quickly and you have good transportation. So in the US, it's much more difficult to visit a person. Like you could drive an hour and you visit that person's not home. And this happens a lot. And so now contact tracing is about finding people that have been exposed to the disease, right? So in America, we do not have household registration. So when somebody hop out of the airplane, you don't know where the person went. Maybe maybe Uber or something, I don't know. But if they rent a car or something, you have no idea where they went. So then how do you tell people that, oh yeah, while you were on that flight, there was somebody sitting right next to you with COVID-19, and we really want to tell you, but we couldn't, right? And that's why I think that right now I think the Apple and Google app with the Bluetooth, that's going to be very important because they keep records of if you're close enough to get a signal for the Bluetooth, then you ought to get notified. But then the opportunity is here. The opportunity is who should do the notification. Like how do you notify the person? Like who should have access to the data on the contact IDs, and how do you inform them? And then who should do that? How does public officials use the tool, right? And then if you tell them they have it, how do you do quarantine? Like in Taiwan, if somebody has been in contact with a COVID-19 positive patient, that person has to be in self-isolation, right? Because you've been in contact with the person. So then how do you do that? How do you enforce self-isolation? And then if the person gets sick during self-isolation, how do you get that person to care? And first of all, how do you get that person to get tested? So that person first needs to get tested if he or she is positive or not, right? Then you need to let them stay in the same place. Then if they get worse, you need to get them care through a special route, because you don't want to just head into a hospital and mingle with the other patients, like cancer patients that are immunocompromised, right? So all these, you need to develop a technology package so that the health officer would just be like, okay, this is a great tool. So anybody could pick it up and use it. And then you do this part, you do that part, you do that part. And then, okay, this person is tested positive. I got the data back. Okay, now we got to make sure this person is definitely self-isolation, quarantine. And then how do we follow up on the symptoms? And right now in Taiwan, you have a lot of these done by people, by health officers that are well trained. So in the US, a lot of these have to be done by technology. And so there's a lot of opportunity in the follow-up care space.
This is a really important point that you brought up, and is actually the number one question that is being asked, that's upvoted on the question and answer here. You mentioned that things like contact tracing are key, but there's a trade-off with privacy. And so the top question from the audience is actually, what is Taiwan's data collection policies and general cultural attitude towards privacy? And is this really applicable to Western countries, right? Our neighbor to the west of Taiwan obviously has a different view on the nature of privacy. So there's this gradient, and Taiwan is somewhere in the middle. Where is it exactly? And to what extent should we be, doing that trade-off of privacy versus data?
Yeah. So let me give you one example, right? So they say, I want your travel history, right? So I want to say, I'm going to take 14 days. You know why I'm going to take 14 days? Because that's the incubation period for the virus. So I don't care if you went to China 3 years ago. I don't really care about that. I just care if you went to China 14 days ago. And that's because it's needed information for me to help you. So you only take the minimal required information. Okay. So Taiwan also does this digital fence thing. And as far as I understand, so far it's based on cellular signals. Maybe GPS will be introduced later, but so far it's based on cellular signal. So if you got a good signal, and they could triangulate where you are, right? And if you get out of that area they want you to, then they will start tracking you down. And if you turn it off, you get no signal, they know you just turn off the phone, or maybe your phone went out of battery. They'll knock on your door. And these are going to knock on your door, say, hey, are you home? And then if you're not, they will send a police officer after you because they don't want you to hop on the metro and infect other people, right? So basically, you take the minimal amount that you need to know, and you try to make it so that the data is not kept forever. So cellular signals are not kept forever. However, if, for example, the Diamond Princess, right? That ship has 2,000 people undocked and went around 50 places. If you live in those 50 places, or if you have been to those 50 places, wouldn't you want to know? So they sent you a text message, say, if you've been to this place, it's called 1922. And so you call 1922, and you try to get yourself a test, or if you have symptoms, you report it.
Now,
So
Professor,
that's minimal.
This case is actually understandable contact tracing where you've been. I mean, it does touch upon privacy, right? Like if you've been in strange places, you're going to be exposed, right? But you probably shouldn't be doing that in the middle of an epidemic anyways. But let's give a harder example. Now, Minister Chen, correct me if I'm wrong. One of the special things about Taiwan is that we have universal healthcare here. We have one of the world's most extraordinary medical databases, right? With all this information. And as I understand, one of the greatest things about, and most effective things that Taiwan did was to link the medical database with the travel database, right? I mean, this is crossing departments. And this is one of the things that the so-called Central Epidemic Command has the ability to do with emergency powers, right? This is not an everyday thing. So is that one of those things? But now, Minister Chen, you're linking medical data. So how is the balance? How do you protect privacy? And is Taiwan okay with this?
Yeah, I think, as I say, we use a technology. One of the technology is big data. So big data, I think if we promote like AI, every people about talking about you need to use data, and the data will link to the privacy. So there is always the grand line. What's the purpose you use those kind of data? So in Taiwan, we keep all the public health data, as you mentioned. This time we try to, because we need to gather the TOCC, the travel history, and also the contact history, and also the potential cluster and occupation, of course. So we call it TOCC. And we combine the public health data with immigration data. So it's easier because immigration, when you enter the border, you have the record. You know, we use this kind of data to do the computation and identify those people. And as Jason mentioned, we are not tracking all the people actually, but we're tracking the potential you need to isolate the people. And so we need to have some regulation to help that. As I mentioned, we have the experience also. We do have some regulation without to avoid the personal privacy issue. For example, maybe I can show you another case because Jason just mentioned the Diamond Princess ship. Actually, Taiwan encountered a big challenge these days because 3 days ago we have the army ship and have the containment right now. So during that case, currently we already have 27 confirmed cases, and because those people travel around the whole island, around more than 30 different kind of places. So we use the technology to identify around 2,000 people have a close contact, and those 2,000 people all can identify using this maybe using the Jason mentioned using the serial information. But after that, for the second shield, we announced the warning system to more than 20,000 people who have potentially the chance to come to close contact with those common cases. So I think how to adapt the data, you need to trace every people. However, you can understand what's the situation for some area. For example, another case is in the Qingming area. We have this this chart, this is also the use of sample data. You can see the people get together in as a we say is a cluster potential contamination. So at the point that we send the warning signal to the population, then population going out. This system is come from not for the epidemic virus this time, but come from the National Center Disaster Reduction. We have as I said, we got the disaster every year. So every year when we have the special like a Taiwan attack or some of the area, we identify the people in this area, then send a message to all the people. We call it cell message warning system. So we have this kind of warning system that it's easy for Taiwan. We can identify the people when we need to isolation or even the quarantine. So of course, the social supporting is very important. As I mentioned, we have police supporting, Liang supporting. So when the people got lost from the technology, we can use social help. So not our system need to support. That's why we mentioned some of the experience we can share with some country, because it's not avoid the private issue, but you can use that technology to help. As I say, it's try to make the people not so many inconveniences, then people will help cooperate with the government.
Great. Well, yes. So number one, through Taiwan's example, and also through sharing of actual data in terms of the spread, in terms of epidemiology. But Jason, Professor Wang, that's the key, and that's actually one of the things that's the top question right now, is Taiwan's doing all these things, right? But it had the databases, it has universal healthcare, right? How much of this is really applicable to the rest of the world, and specifically where you are? You're in San Francisco, you're in lockdown. What are kind of the specific points you think that we can take from what Minister Chen just said and really spread to the world, if there's one or two top lessons, if you will?
Yeah. So I was talking to Google this morning, and they are pretty good in tracking people. Yeah. I mean, they even know where you're going. I mean, the moment you turn on your car, right? So they could do that. It's a matter of whether or not they need to do it in an appropriate way. And so when people think about violation of civil liberties, let me just pause a little bit and then let's break down what that means, right? So in an epidemic, there's a social contract. Not only you're endangering yourself, you're endangering other people. And this is a deadly virus. So it is unethical not to report. So when you talk about ethics, you need to think about the social contract. If you have the disease, you hop on the metro, you infect other people, and that's somebody's grandma just died. Okay? So basically, we do this for sexual transmitted infections that is reportable. Okay, so you need to think in that context. Now, in terms of thinking about technology, you develop an awesome technology. There are three ways to do it. You could opt in to the technology. You could opt out. So that's in the choice architecture. So if you use the opt out method, basically, you change the choice architecture, the default is yes. And you have to opt out to say no. That's a nudge. Okay, that's the change in the choice architecture. Or you could make it mandatory. Now, it depends on what the impact of the virus is. Okay, now this particular virus spreads really fast. It's only been 2 or 3 weeks when New York got hit. Look what happened. Now, if you're going to use traditional shoe leather contact tracing with interviewing people, I'm telling you, I don't even remember what I ate for lunch, let alone how many people I met. And if there's someone sitting next to me in the metro, I certainly would not know that person. So when you're talking about a potentially deadly threat to other humans and it's spreading fast, you have the social obligation to create a set of rules for society. Otherwise, your entire society will get wiped out. Your whole city will get wiped out. So basically, it's a trade-off that we're talking about trade-offs here. Depends on the virus, depends on the threat, and you have to match it with the technology and all you got to mitigate the threat. So I want to put that in context because a lot of people are not they don't think very deeply about civil liberties. They just think that some big government is going to track you. But what about other people that you might be impacted?
I see. So you're saying because of the social contract and because you have an obligation, it is actually the right thing, a good thing to at least share some amount of data. What that balance is there's a fuzzy line, but it's very clear that it sounds to me, Jason, you're saying, for example, the US should be a little bit more like Taiwan and can learn that lesson from Taiwan of actually releasing that data under this concept of the social contract.
Well,
that it is
let me just give you another example. Okay, this Google Apple app, if it's opt-in, and they say in Singapore, only like 20-30% of the people opt in. It's not that helpful. If only 20-30% of people opt in, it's not that helpful. If you change it to opt out, all of a sudden people have to make a decision. Okay, do I really not want to be informed? Right? And then I don't think you should make it mandatory. That's a little too much. All right, that's a little too much for technology. But you have the choice, and depends on what the society as a whole. You could take a poll of your citizenry, and you say, for this virus, this is what we know about the virus. It spreads really fast. It could kill 1% of the population if infected, and you could get it anywhere, and it stays in the air, and you could touch anything. How do you want to be notified? If somebody next to you is sitting in the metro has it, and you are close enough to get it, how do you want to be notified? And you could do a poll.
Right. Okay. Well, so is what you're saying, Professor Wang, and correct me if he's wrong, Mr. Chen, but basically what you're saying is Google, Apple are building things, and this is a question from the web, are building things that Taiwan has already built. Is that correct in terms of contact tracing? Now, I'm not sure about the opt-in, opt-out. I'm not sure that Taiwan has the opt-out option, but it's definitely taking that data, and it's doing a very good job of tracing it. But why doesn't, for example, the US just work more closely with Taiwan and take that technology? Why do you need to reinvent that from the ground up? Or is there a need to?
So first of all, I don't know if Taiwan has built a Bluetooth-based technology the way that Apple and Google has done with the phones. I have no idea. I know Singapore has one, tracing together. That's very similar technology. Okay. Now, secondly, to completely just import technology to the US, first of all, you have to understand the US environment. Like, you can't just take a tool that you use in Taiwan and then you have Li Zhang and all these other people helping you with the public health officers, and then you take it to the US and you have to really think about the delivery system. That's what I was talking about before. People live pretty far away, and sometimes you can't find the person, and they have no household registration. So then how do you create a technology for that? And so if you're an entrepreneur, you have to think about market size, right? So something that might work for Taiwan may not work for Africa, may not work for Europe, may not work for the United States. So where is your market, and what's the infrastructure there for deployment? And I think that's something that people have to think about.
Gotcha. And now we've been talking about contract tracing for a little bit. Let's put that aside now and talk about some other elements. One, to start with, Professor Wang, you are in lockdown. You're the only one in this presentation. Again, Taiwan is open for business. We're calling from an office. But obviously that has strong implications. So beyond the science and technology, beyond government regulations, beyond apps, you as an individual are going through this. What are the needs there? What are you facing, and what do you see society needs, even from that standpoint of just, there's a social and psychological component as well. Are there needs there?
Yeah.
You can share with us, since not all of us are in that situation.
Yeah, let me just give you a few examples. And first of all, just call me Jason, because I'm much more comfortable that way. Okay. And I usually don't wear a tie just in case. Okay. So in terms of social needs, there's great social needs. I'll tell you. I was in clinic this morning, so they do let me out to go see patients in the clinic, and I come back. Okay. Now, among my patients, there are people, and I work in a federal qualified health center for poor people. So that's all I work there. A lot of my patients, they rely on school lunches. So they go to school to eat lunch. Okay. If they don't go to school, they don't have lunch. They're poor. So now, you know what we're doing? We're doing reverse school buses. So before we pick up the kids to go to school, right? Now the buses take lunches to go back to the communities where the kids live, so they could drop off the lunches. There's great social need. Okay. Now I'm okay. You know, I'm in my room. It's very comfortable, but there are people, my patients' families, that live in very crowded conditions. They have like 3 or 4 families living together, and it's very noisy. They cannot learn. The children cannot learn under those conditions. They barely have cell phone access and internet. So you want them to do homework on the phone? I mean, do they have a computer? Do they have good Wi-Fi? And so you want them to do social distancing, like 6 feet, impossible. And by the way, their parents are day laborers. They have to go to work. One day they didn't go to work, they don't have income. So when you think about a society, and certainly with disparities, any society has disparities. You have to think about, well, who's the most vulnerable? And when you have a government policy that tell people to stay at home, how do you help the poor people? How do you help the people who cannot go to work? And how do you create technologies to help those kids learn? That how do you provide internet service? How do you give them tablets and computers so that they have the equal chance of succeeding in society than the people who are well-to-do? So this is actually the responsibility of entrepreneurs too. I mean, it's part of the very big part of social entrepreneurship, how to equalize society with what you got, with your creativity.
Gotcha. So now, taking a step back as well, now that we kind of have an understanding of life and what its daily needs and the social implications and consequences, coming back to Taiwan, Mr. Chen, one of the things about Taiwan that's also extraordinary and that you have a view on are really 3 things. One, which I mentioned, is the stage 2, is our amazing industry, which is open for business, one of the few in the world. And so we are now the number 2 mask producing nation in the world. And we are now producing excess masks. And in fact, there's this talk about mask diplomacy and a competition with China, for example. So you have a view, because from science and technology, this is about innovation efficiencies, right, through creative production. You also have, most of all, a view in academic research labs. And so what I'd love to for you to talk about is what's in those labs that we can use. And that goes to the 3rd component, which is us, the citizenry, entrepreneurs, founders. How do we interact with the MOST? What are the things there that can immediately be leveraged? Are there any needs or immediate technologies that we can take from the lab and apply to the problems that Jason has already mentioned about today?
Yeah, okay. As Jason mentioned, very good point about the social responsibility, especially for the poor family or poor people. Yeah, I think the whole society faces a lot of challenges come from this virus attack, and but consider about we need to separate different kind of the task and give the solution. So based on the responsibility of means of science and technology, our viewpoint is if we can have use the technology to, the first one, of course, try to kill the virus. If we can kill the virus very quickly, I think all the problem is gone. So the first priority, we help and support the laboratory, try to find the solution. So that's why I mentioned vaccine is the most important one. In Taiwan, we spend a lot of effort, not using the budget, but also help all the medical scientists and join together with like even AI computing power to together to find the solution for the vaccine. That's one. The second is try to test all kinds of potential drug to do the treatment. There's a lot of people when they got an affection, they encounter the danger situation. So if we can get them back to their health, then this kind of solutions, half the solution. So the third one is using technology to provide a quick test. I think if we cannot kill the virus, then try to identify, as Jason mentioned, we need to avoid from like test positive, test negative, and jumping around. So have the accuracy and very reliable machine is also very important. In Taiwan, we are good in science and technology joined together. So for the testing, for example, we have already some equipment that they combine with automatic testing. So we can try to increase the capability for diagnosis or testing very quickly. And those kind of equipment, I think it's very easy and potential to scale up. So if any country, for example, maybe I can show you one of the, this is one of the, we call it test equipment. It's automatic already, and all the software and hardware is built in Taiwan. So we can increase the diagnosis very quickly. And I think this technology can help some society quickly identify people already have common cases and try to shorten the lockdown period. And I think some social problem can be solved. So as the technology people, we try very hard to adopt those kind of technology. So we currently already have some, we call it Taiwan team. We have the face mask Taiwan team. And since this is controlled by government, so we use government channel to help some of the country need to help. And I think as an entrepreneur, we can do a lot, like using the innovation come from the test equipment and come from the drug delivery system. And also we have some provision innovator. For example, we have some team in TTA, like we can provide electric chlorine is one of the technology that can provide change the water to become this is the picture we can show in the last one. Yeah, this one we can very easy to provide the product, help people that can clean the environment. And this is some of the test equipment that we can do the help the medical doctor can do the distance acute diagnosis. So a lot of technology in TTA, we can also help the society. I think those are the responsibility come from innovator. So most will spend more effort to help all the scientists and technology, leverage the technology to become the entrepreneurial product and try to help the whole world solve the problem, solve the source from the beginning. And I think that the other social problem maybe can be reduced earlier.
Fantastic. And Minister Chen mentioned this, but not only is about the research labs, but the commercialization of the technology, because in many societies, those things get stuck in the lab. One of the very interesting things about Minister Chen is his initiatives. As mentioned, he started the Startup Garage in NTU when he was a professor there, and he created Taiwan Tech Arena, which is also there to foster entrepreneurship, which Techstars is also a part of. And so one question is this basically a set of technologies, talents, and tools that we here in Taiwan, and you mentioned the world, have access to? And if so, how do we access it? Because it's in a lab, right? Do we go through the incubators, technologists? Do we go through the scientists? Do we email you? Like, how do we access technologies and learn more about it? What are the resources for doing so?
Yeah, basically we have the contact window for the TTA. So TTA is one of the, you can say it's a single contact window that we can try to leverage the academic and entrepreneur together. So I think our staff can try to put the link of the TTA. And all the people in the whole world, if you encounter any demand, you can try to reach the link, and all people will contact with you. And hope that we can leverage together some technology, some scientists, and some maybe come from academic laboratory together to face and solve the problem. I think that's the first one. Then we can try to establish the scale-up channel, like how to deliver the product to. For example, we have already have some diagnosis unit deposited in Denmark, and got a very good experience to confirm the cases for Denmark people. So I think we can, those kind of product currently used in Europe, we hope that those technology can help the different country maybe have a different demand. So we can use leverage resources to put together, and I think that's we think that's the main power that we can help the whole people.
Fantastic. And since we're talking about entrepreneurship, and we only have a few minutes left, Minister Chen, you've done a lot to support entrepreneurship in Taiwan, along with many of the other agencies and the government in general. And in fact, this flows even to the presidential level, really trying to encourage that here. So we as entrepreneurs, thank you for that. And then Jason, Minister Chen mentioned that you're an entrepreneur. You founded your company several years ago out of Stanford. So, taking a step back, I mean, this is a crisis, but with every crisis is a turning point.
Yeah.
And so I would love your thoughts from the entrepreneurial, from the founder, from a citizen activist point of view. Like, what is your advice to the founders and entrepreneurs out there in the world? How do we go and attack this? And how do we enable and marshal those resources? How do we work with the rest of the world? It's an open question, but it's just basically advice to the entrepreneurs, founders, and innovators of the world. Jason, maybe we can start with you and then end with the minister.
Sure. So I think when the minister says the Taiwan team, I assume that he means the private-public partnership to form a team. And that recently there's a term called civic technology, where you have some government and some private, because healthcare is very sensitive. It's it has a lot of privacy issues, and so you actually need to work together. And the role of government is really to incentivize people to do the right things, to coordinate all the activities, and then to regulate in some cases when the law applies, particularly in healthcare. Now, in terms of being an entrepreneur, I see many opportunities here for Taiwan. For example, our clinic at Stanford now is now 60% telehealth. Now think about that one. We spent years and years trying to push telehealth, and all of a sudden, almost overnight, within a week, it's converted to like over half telehealth. What does that mean? That means a lot of opportunities for remote physiologic monitoring, monitoring people at home. A lot for sort of the change in the delivery of services. So you have to think about how to capture data from people. That's the first opportunity. The second opportunity I see is that in a lot of the developing world, where there are no viable technology and no capability to integrate technology, I think there's a great opportunity for Taiwan, particularly for Taiwan's allies, right? The places where some places in Africa, some places in South America, the technology deployment could be life-saving for them. And the other thing is the vaccines, right? The vaccines and the therapeutics. How do you produce it in a massive amount? So let's say we get a vaccine next year. You know what's going to happen? Not everybody's going to get it. The rich people are going to get it. People with insurance are going to get it. But it will trickle. It will take a while for the developing countries actually to get their share, right? Now, if Taiwan steps in and say, no, we could produce a massive amount. We have that capability, is really good vaccine, really good therapeutics. And we just, deliver it. That's an enormous contribution to the world. And so I think when people say Taiwan can help and Taiwan is helping, you have to think about strategically how to place your resources to help the world. And with that, you will gain friendships that will last for a long time.
Great. Thank you very much, Jason. Minister Chen.
Yeah, as Jason mentioned, I think there is two viewpoints. One is the government role, because healthcare is also a very important issue for all the people. So government need to play an important role. I think that's why we mentioned the whole world need to let Taiwan to help, because Taiwan has a very good experience play as a very good government role. This kind of experience can share not only in the developing country, but also some developed countries still need to have this experience. And the other one, as the viewpoint of entrepreneur, I think this any challenge, any crisis is a good opportunity for entrepreneur. I support Jason mentioned is telehealth should be very important opportunity. Sometimes we call it digital health because it is combined big data with IoT. So this is a very good opportunity for all the new startup, all the entrepreneurs, not only face the crisis, but also face every person will have a personal care of health, and using the new technology, we can do that. So Karen also can help in this kind of area. We have a very good industrial supply chain, and all the IT technology will combine with medical health right now. So this is very good opportunity. I think we welcome the entrepreneur in this area or interested in this area, come to Taiwan or come to join the link of TTA, and then you can get all the supporting from Taiwan.
There you go. And due to lack of time, we can't answer all the questions. I know there is a very lively discussion online, offline. This is the point, is not that we're going to cover everything today. But there's another really important point, which the minister through TTA and through Techstars is supporting, which is the Global Grand Challenge. And so we're going to post that again. The green button is going to pop up below. We hope every single person, whether you're in lockdown and in your living room, or whether you're out and about in the streets of Taipei and meeting people and talking, thinks about this, right? This is a very, very important problem that is worth your time and energy, even no matter how small it is, to think about. And that is the Global Remote Startup Weekend that's focused on solving the COVID-19 problem. This is just a taste of it today. This was really meant to set the stage for where we have been, where we are, and then now we all collectively think about where we can go forward and what we can do together to collaborate on online platforms like this. So with that, I want to thank our very special guest today, Minister Liang-Gee from the Ministry of Science and Technology, and Professor Jason Wang, coming from his home in San Francisco and usually at Stanford University. So gentlemen, thank you very much. I hope you'll be available as online resources and we can continue this discussion in the future. So again, good afternoon, good morning, and good evening, wherever you are in the world. Thank you for participating, and please continue to participate.
Thank you.
Thank you.
Bye-bye.